Like my ideal day is an entire day of people that come in healthy that are saying, "Hey, keep me healthy to the next time I come in." Because if they can see me consistently and I can see them, let's say 12 times a year and they're injury free for the entire year, and then they're coming to me somewhat for some advice and some motivation. Maybe it's kind of, kickstarting them in their diet. I mean, these are things that like that makes my day. It's much harder to work on injured people all day. So our goal is to kind of get people healthy.
Hello there, everybody, and welcome to another episode of the Orthopreneurs Podcast. Today, we have somebody very special, someone who's a friend, someone who's actually a provider of mine. And unlike Jeff Galvin, who you've heard a million times, this is another Jeff. Please welcome, put your hands together and welcome Dr. Jeff Skarela to the show. Welcome, Jeff.
Well, thanks for having me, Glenn.
Absolute pleasure. This is one I'm just going to give you a spoiler alert here. If you are in any way an athlete, a competitive athlete on any level, if you have a child who's a competitive athlete on any level, today, this is the episode for you. If you dream of becoming a competitive athlete, even if you're a weekend athlete, even if you're not an athlete, but you injure yourself every now and then, this is the episode for you, because we'll uncover a little bit about what it is exactly Jeff does, because it's not the easiest thing to explain. But let's start here, Jeff. Do you mind telling everybody a little bit about how you ended up being where you are now?
Yeah, sure. I was born in Connecticut. My dad's a tennis pro, and we moved to Florida probably about first grade. I grew up as an athlete. I had a twin brother. He and I would compete all the time together. And I ended up going to Florida State to play tennis. And I think this is where I started to realize I wanted to be part of, something involved with sports. So I went the typical route of sports medicine. I started to kind of shadow a lot of the orthopedic doctors that we had. And what I found was they typically were really nice people, but they tended to drift towards a lot of just injections and medicine from the get go.
Yeah.
And so this was something that I kind of had to toil with if I wanted to really kind of go down that path. And I ended up kind of looking for something else. I got into the physical therapy space for a minute, shadowing there as well. And then I actually had a friend here in Dallas that was going to chiropractic school and came to visit him. Didn't really know much about it. I think my dad had seen a chiropractor for a little while just to get his back adjusted, but ended up really finding that the scope of practice that chiropractors had was more of a space that I could do. They didn't do surgery, they didn't prescribe medication, but they could really kind of curate their own type of practice the way that I felt like I wanted to do.
Nice. And so everybody hears you say, "Oh, chiropractor."
Yeah.
But as somebody who goes to you, and I'm going to be happy to talk about the doctor-patient relationship here.
Sure.
If you go see Jeff as a patient, he's not going to prescribe to you, come back twice a week or 3 times a week for the next 3 months and let me adjust you. That's not his kind of practice. I have been adjusted by him on his chiropractic table, but the overwhelming majority of what we do together, aside from talk about the science and a lot of therapeutic modalities, which we'll get into today, um, there's a lot of other things like muscle scraping, flexibility, working on range of motion. You said something, and by the way, he is not a physical therapist, right? You're not a physical
No.
therapist by training.
Yeah.
You are a chiropractor by training.
Yes.
However, I think you said to me when we first met that what you would be referred to at best would be, if we were in Europe, you'd be called a physiotherapist, right?
Yeah. Yeah, that's correct. I think, the chiros here fall into couple different camps. Obviously, there's many that treat like me, but yeah, we try to use a lot of the different modalities to try to, curate a kind of like a concierge visit for you and use everything that we have in our disposal. And so I think that, some people get caught into the, high volume sort of practice, which I don't like. And I always wanted to go to a practice that like I would go to as an athlete. And so that's really someone one-on-one that is going to change every single visit based on how you come in and what your injury might be and, tailor it specifically to you.
And you said something when I first met you that really explained this really well as we get into this. You said, and I'm gonna paraphrase, but I want you to pick it up once you recognize it. It was about the difference between a physical therapist and what you do is that a physical therapist is going to give you exercises to do and to rest,
Yeah.
right?
Yeah,
Please do it. You'll do it better justice than I ever will.
yeah, and I'm definitely like, stereotyping here. But a lot of physical therapists actually do one of two. A lot mostly prescribe exercises, and I think the space that they've owned is really like post-surgical space. No, there's a lot that are branching out and advancing that. And some do manual therapy, but there's not a lot that do both. And then we also have the addition of adding in chiropractic too. So I try to kind of do a lot of the manual therapy, restoring range of motion, looking at the foundation of mobility. Then we will look at, obviously, the skeletal alignment portion of it, and then look at the stability portion. And I think if we can kind of package that all together, I have the luxury too of having a lot of fit, like healthy, educated people that want to get better on their own. And I think
Right.
the majority of that stuff, initially they can do on their own, and we'll kind of guide them in that direction. But there are some people that need a lot of accountability, and actually, I'll refer out to a lot of physical therapists that people really require that.
Yeah. And, for those out there who don't know, this is how it works. I go to his office, generally for me personally, once a week, sometimes twice a week, or even 3 times a week if I'm really hurting. But I'll go to the office once a week. It's a 30-minute session where it's just me and Jeff. There's nobody else in the room. And he has 30 minutes where he's legitimately 30 minutes hands on working with me. Um, it's really interesting because I go to, for those out there who've been following me at all, I tore my ACL about 8 weeks ago, and I had surgery about 6 weeks ago. And I've been going to see a physical therapist, traditional physical therapy, which is great. I'm getting some great hands-on care with a really good physical therapist. But I am appalled when I look around the room when I'm there for my hour or two to see the physical condition of the people in that room. The people who are getting, I mean, and I'm going to do another podcast on this in and of itself, because the overwhelming majority of people at a physical therapist are significantly overweight, way out of shape, terrible range of motion. And anybody out there says, oh, Glenn, stop judging people. It's just a fact, okay? The overwhelming majority of people I see at physical therapy are in terrible shape. Contrast that to the overwhelming majority of people I see coming into your office, Jeff. As you said, they're athletes. And the big difference between what Jeff does and what others do is that you're keeping athletes in the game, right?
Yeah,
Like,
yeah,
I do tons of jujitsu.
yeah,
At my age, I'm competitive.
yeah,
I have a tendonitis, or I have an ankle that's hurting, or a knee that's hurting. And for
yeah,
30 minutes, you'll work on range of motion. You'll work
yeah.
on maybe
And
scraping.
a lot of and this kind of starts with the first visit. Most people that I'm seeing obviously come to me with an injury, but obviously, we talk the entire time. A lot of it's education, and I try to really get across to the message that we will lead to some prevention at some point. Like my ideal day is an entire day of people that come in healthy that are saying, "Hey, keep me healthy to the next time I come in."
Right.
Because if they can see me consistently, whether it's once a week like you or once a month, depending on someone's activity level, and I can see them, let's say 12 times a year, and they're injury free for the entire year. And then, they're coming to me somewhat for some advice and some motivation. Maybe it's kind of, kickstarting them in their diet. I mean, these are things that like that makes my day. It's much harder to work on injured people all day. So our,
Right.
our goal is to kind of get people healthy and then just really educate on the prevention practice.
Yeah, and for me, I'd say probably 50% of the time I come in, there's some little tweak or problem, nothing major, but probably
Yeah.
50% of the time I go, "Oh, I'm feeling pretty good, but hey, I'd love to work on the flexibility here, or this side's been feeling a little tiny drop sore." And the nice part is, like you said, for 30 minutes we're talking, and that's the crux of today's conversation. Because for those who may not have, well, you actually didn't say it. Now you're a competitive cyclist, right?
Yeah. More of a triathlete, but
Triathlete.
cycling would be my favorite. And I've done a lot of cycling events as well, but yeah, all to kind of better my triathlon, career.
Yeah. And for those who aren't watching this, who are listening, Jeff just sickens me because he's like the prototypical build of the guy who I always wanted to be. How tall are you? About 6'1", 6 foot
Yeah,
two?
that's 6'2".
Yeah. He's just, and he's lean
Yeah.
and he's sinewy. And I just thank God he doesn't get into jujitsu because then he'd kill
Yes.
me. Um,
Yeah, not quite.
no time, but he's a super competitive um, athlete in an aerobic sport. So we have the opportunity to talk about aerobic, anaerobic, range of motion, and the best part is you like to follow people that I follow, like
Yeah,
Huberman,
yeah,
Atia, Ron
absolutely.
Patrick, David Sinclair. So when I'm in the chair, I have to suspect our conversations are slightly different than a lot of your other clients, where we really talk for 30 minutes. We could be talking about, VO2 max studies
Sure.
or lactic acid or,
Yeah, yeah. Our conversations are slightly elevated, so we have a lot of give and take, which I enjoy.
yeah, well, let's start here. Let's start with VO2 max, right?
Sure.
Because I think some could argue that that's the essence of athletics from an aerobic perspective, right? The higher your VO2 max, the better you'll likely perform. And I think there's even studies now link VO2 max directly to longevity, right?
Yeah, yeah. I mean, I
I
think
want to disbelieve those because I do
it's
not have a great VO2. So I want to believe that
yeah,
that's
but
complete BS and there's no
yeah.
truth to it. But
I
talk a
think
little bit
it's
about
more of a
VO2.
yeah. I mean, I think it's actually more of a proxy, right? They just assume that you can't cheat a VO2 max test. You either put in the work to get more fit or you didn't. And a little bit of the conundrum with Ironman stuff like I do is actually having a super high VO2 max is somewhat counterproductive for long distance endurance events. You could specifically train just VO2 work, which would be, let's just say on the bike, 3 to 4 minute max efforts. And for an Ironman, you shouldn't be anywhere near that. And so one of the top triathletes in the world, this Norwegian Christian Blumenfeld, I think he set the record for the highest VO2 max ever for the Olympics. And they actually had to detrain that for him to get into Ironman because it was somewhat counterproductive to his long distance efforts. But for the sake of longevity and well being, for the average person, it's an easy test to kind of give someone a baseline and really show them that, hey, like we really need to work on some cardiovascular work here. And likewise with a lot of the lactate testing, we can kind of give people that need efficiency in their workouts more of a specific workout that's not just like a random exercise.
Right. But there is, and correct me if I'm wrong, there is a God given a
Oh yeah,
portion of VO2 max. Like my VO2 max, and I've known this from the time I was younger. I've
yeah,
never had a high VO2 max. Like
yeah.
I'll be operating at 170 when and operating. That's the other thing we've talked about, you and I, that I operate really, really effectively at a place where most people are not operating. Right. Like I can operate at 170 for an extended period of time, whereas for most people, getting to 170 is like
Yeah. Yeah,
you're
VO2 max
anaerobic.
is VO2 max is largely genetic for the high ends. But this is where the lactate thresholds come into play, right? Because you may buffer and tolerate a high lactate level, and that's where your gift comes in with a sport that is more short and quick speeds. Whereas, let's just say you could get your lactate up to 12 or 15 millimoles, uh, where I could never even get it to 10, but I can sustain 5 for hours where you might not be able to do that. And so, lactic acid is a byproduct of, you breathing kind of oxygen. It's you breaking down carbohydrates. So the harder you go, the more lactic acid you're going to build up in your system. And so different sports require different levels. And this is where genetics may play out for you, and you naturally found a sport that you're gifted at because of it.
Well, most would say I did not find a sport that I was gifted at.
Yeah.
Just real quickly, because I know we got so many topics I want to hit.
Yeah.
What advice is out there based on the science about how one can train their VO2 to get better? Like if I said, because I think people make the mistake out there going, I'm going to train my VO2. I'm going to train my VO2 for no, like if I train your VO2, what does that mean to you? Right. But if one wanted to train their VO2 and get it stronger, what is the best way to do that?
Yeah, I think the simplest way is the bike because you rule out any inefficiencies and risks. So if someone didn't run and they went out and ran VO2 efforts on the track, they're probably going to pull a calf or a hamstring and derail it. But on a bike, you're pretty safe. And that's basically kind of going as hard as you can and sustain it for about 3 to 4 minutes. And then you would build reps of that. So the first workout might be 30 or 40 minutes, and you're doing 5 rounds of 4 minutes at VO2 with equal rests. So usually when you're doing a hard effort like that for 3 or 4 minutes, you're also taking 3 to 4 minutes rest in between.
And just to be clear, we're talking 3 minute or 4 minute rounds of your max. Are we going to anaerobic? We're going as hard as we can to the point where we can't go more?
I would say the first rep usually indicates that. You learn a lot from the first rep. So if you're going as hard as you can in the first minute and you fail, the next one you're probably going to learn to kind of pace that out a little bit, and then the more you do it you get comfortable with what your effort should be for that.
Got it.
But yeah, I mean, I think anybody doing it multiple times is going to kind of find out real quick you don't go out as hard as you can. Your goal
Got it.
is to finish as hard as you can.
But the goal is to basically, for each round, to cross that tape with almost nothing left aerobically, where you need
Yeah.
that 3 to 4 minute recovery to catch your
Sure.
breath and get back,
Yeah.
right?
Yeah. Yep.
Okay. And while we're on it, since we just like having conversations about this stuff, longevity been
Yeah.
linked to grip strength, right?
Sure. Yeah. Yeah. I mean, I think also another proxy for lean muscle mass, right? So the more lean muscle mass someone has on their body, it begs that they've lifted weights, they've exercised, probably more stable. And these people just tend to live longer. There's so much that we could talk about a lot about lean muscle mass in terms of, you know, the more muscle mass you have on your system, the more reservoir or storage spaces you have to store and metabolize carbohydrates. That's been linked obviously to decreased metabolic syndrome and heart disease. And so, like, yeah, these high grip strength, high VO2 max both mean you exercise.
Right.
And
Right.
so now curating the type of exercise, I think, might like lend itself towards what kind of things that you do in your life. And this is where I love the Peter Attia centenarian decathlon. So he's training for the last 10 years of his life, meaning he doesn't have events like you and I may have coming up, but his events are, maybe, jogging a terminal at the airport or walking up a flight of stairs with groceries or something like that.
Yeah. Yeah. It makes perfect sense. As far as, I had a question for you that just slipped my mind. I apologize. I was going to ask you about grip strength and VO2 max and those sorts of things. But one of the things we do, just because I'm going to jump around a little bit, one of the things we do when I'm with you, and something I'd never seen before, is muscle scraping, right?
Yeah.
Which
Yeah.
I forget the name of the, hold on. I think if anybody's watching, I actually, because of you, I bought my own set. So, this is a classic muscle scraper,
Yeah.
right?
Yeah.
Right. If anybody is looking and watching this on YouTube, I'm trying to get it in focus, but it's just doing a terrible job of this. But there we go. You'll use this kind of device or any shape there, which is stainless steel, I
Mhm.
assume.
Yeah.
And can you explain to people what scraping is? Because I'd never seen it, and
Yeah.
what it does and where it's indicated.
Yeah, yeah, we and a lot of times I predicate that by getting my hands on there and just doing a lot of active release, which is, myofascial release therapy. And so the scraping is kind of a play on that as well, is that there's a lot of things that I just can't break up with my hands. They might be harder scar tissue deposits, they might be closer to a joint where it's just hard to get my hands in. And so the scraping essentially breaks up a lot of those fascial adhesions and scar tissue deposition and calcium buildup. I kind of use this kind of analogy all the time, but like our tissue should be like a filet mignon, like soft and moldable and pliable. But a lot of times, due to repetitive traumas and stress, I mean, they turn into beef jerky, basically, like sinewy pieces of meat. And so we are trying to rehydrate that. So scraping, it gets a lot of blood flow in there. Manual work gets a lot of blood flow in there. And then hopefully we're setting up the tissue in the best possible environment for you to strengthen it, right, with exercise. And so if you take a tissue that is just beef jerky and just try to exercise the heck out of it, it's not really going to adapt. And so we're trying to set you up in a position for that thing to adapt and really absorb, also get pliable and flexible. And, this is kind of like the Tom Brady model, like get the muscles supple again.
Yeah, and I think a lot of people don't know about the Tom Brady model. Do you want to take just a few
Yeah, I mean, I
seconds and explain
think
that?
he kind of credits a lot of his career and lack of injury to a lot of his kind of caretaker that did a lot of this soft tissue work. Even Michael Phelps did a lot of the, scraping, and obviously he was doing a lot of cupping. But yeah, the scraping has been around forever. I mean, I believe they found like in a lot of the like Eastern medicine, they used to do it with coins, like old gold coins. They'd kind of scrape it on there. I think they even found like some ivory or some bone scraping tools in some of the Egyptian tombs. And so this has been around for a while. And if you're looking how a lot of the medicine now is evolving, it's all centered around blood flow. I mean, this is the whole point of like PRP therapy or injections. And we're doing it non-invasively, and we can do this more frequently. And so I think that if you were able to kind of get a session from me, and then you have your tools at home, and you could build 3 to 4 sessions a week per problem area, you're building, over the course of a month, 16 to 18 sessions. Like you're going to get better as long as there's not a traumatic injury in there.
Yeah, which I did have.
Yeah, well, can't go internally.
Completely unrelated to anything you've done.
Yeah,
I would say in spite of what you've done,
that's right.
although, there's no avoiding what happened to me.
Yeah.
Um, But while we're talking about modalities that you can do at an office and at home, let's talk a little bit about shockwave therapy. Again, something that a lot of people don't know anything about.
Yeah. Yeah. Shockwave, and there's a range of machines, really for the sake of ease, based on depth. So take a tennis elbow or plantar fasciitis or an Achilles tendinosis, compared to like a high hamstring strain or a glute tear, something like that. So different machines have different wavelengths that the shockwave can go in there. But I think these things were invented really to break up kidney stones. So these ultrasonic waves can kind of penetrate deep. They vibrate tissue, let's just say kidney stones or calcium buildup areas, where we're targeting these around tendons and muscle where there might be calcium or like scar tissue buildup to help also get blood flow and break up.
Yeah, and my orthopedic surgeon loves them. I mean, everything we're talking about here is not stuff that's fringe, crazy. It's just your physician's not talking to you about this. And unless you're going to somebody like you, or you just somehow learned about it from an athlete who's been using it, and so I bought a machine online. I used to go to a chiropractor who had one. I thought it was interesting. They would charge me $50 a session to use it. So I figured, why not go online and find one? I found one, I think, for about $1,500. How effective is it? I don't know, but when I use it on my joints, it feels good, and I mean, I've been having good experiences with it. So, I would tell people out there to definitely consider looking at,
Yeah, there's some conditions that are just really hard to kind of get out. I think the plantar fasciitis, Achilles stuff, these are really tough tissues without a lot of blood flow. And even with the scraping and the manual work, and without going, invasive, which we can get into some needling, but these are just tools in our toolbox. Like if someone came into me for shockwave, I wouldn't just do shockwave. Shockwave
right,
would be kind of like a piece of the puzzle that.
right. And that's the key to everything here, folks. If you or someone in your family is an athlete, it's incumbent upon you to stay hydrated. It's incumbent upon you to stretch. It's incumbent on you to do core. It's incumbent upon you to work the areas that are under the most tension effectively, meaning proper weight, lifting for these things. And it's incumbent upon you to see somebody like a Jeff who's going to tune your body up, from time to time. And and some of the things we talk about a great deal are, for instance, I mean, I know I'm all over the place because there's so many things that you and I have talked about, but let's talk a little bit about, say, something simple, compression boots,
Yeah.
right? Do they make them for
Yeah.
the arms too? Because I've never used them for the arms.
They do. The complaint is that most people feel vulnerable. I've had a lot of women put them on, and if you're doing it at a center, not your house, and you're locked in with your arms at reach. They give you actually a safety button to kind of like diffuse them, but you are kind of locked up in the cross position. So not a
Yeah,
lot of people like them. They make hip attachments which wrap around your pelvis, but don't actually compress like they do with the legs. But yeah, I mean, these are these home devices that, people have the extra disposable income, I think are invaluable, especially for endurance athletes and runners. I
yeah,
mean, you get so much backlog in your legs of just, lack of lymphatic drainage, especially if someone runs a lot and then they're just tired and they sit down a lot or they're at work a lot. You need to kind of move that stuff out of the system. And if you're too fatigued or you can't actively do it on a bike, these things are great to just recline, put your feet up and do for 30 minutes to an hour.
yeah. From cycling, running, anything lower body, even standing doing ortho all day long. When I get home and I'm sitting on a couch or doing whatever, or on my computer, put my feet up, put a pillow underneath my ankles, put the compression boots on. Um, the gold standard out there today is the Normatec 3.0s, I think, is the sort of standard. I will tell everybody. I ended up buying online at Amazon something called the Fit King. It was like half the price. And I got to tell you, I bought the Normatex later, and I'm not telling you which one to buy. I'm just telling you that the Fit Kings for me were so much better in terms of the ease of working with the software. The plug to plug in the air was way longer, gave you more freedom. So if you're going to buy this stuff, pick the one that works for you. And again, I like Amazon because you can buy it, try it for 30 days. If you don't like it, return it,
Yeah.
right?
Yeah.
And they
Yeah.
do sell the Normatec on Amazon too, if I'm not mistaken. Um, I want to pause here for 1 second and just make it clear to everybody that when we talk, Jeff and I, this is not medical advice for you. You are not to take this and go do something based upon what we tell you. It's meant as a starting point for you to have discussions with your physician, your physiotherapist, your physical therapist, so you can make decisions that are right for you. And so again, while I am a medical dental professional and Jeff is a medical professional, none of this is meant to be construed that we're talking straight to you about what you should and shouldn't do. It's meant just as a discussion point to go learn more and consider diving into the research yourself to learn a little bit more about this. You agree,
Yeah.
Jeff?
Yeah,
Yeah.
agreed. I think I love that people come in with all this new information that they read, especially, ChatGPT. It kind of keeps me on my toes and makes sure I kind of stay on top of all the research.
Yeah, it's kind of fun because you and I have conversations about that. And going back to VO2 for a second, I know Peter Attia had that big thing about 140 minutes a week on VO2 at your zone 2 training. And then I read a Norwegian study that said, for something like 40% or whatever it was, or 70, maybe it was 70%, I can't remember the number, are not designed to have an effective VO2 growth from zone 2 training. Um, any thoughts on that whole 140-minute per week at zone
And
2?
I think this is where it comes down to maybe genetics and the individual. Like these are guidelines for everybody, right? Whereas I think the style of exercise. I think some people can cycle, some people can run. Uh, I don't think there's a hard fast rule for somebody, but I do think that there's a linear line that the more exercise you do, no matter what it is, the better you're going to be.
Yeah. And I'll tell people that, like, for if I was still doing triathlons like I did 20 years ago, my training would be radically different than the kind of training I'm doing for jujitsu, right? So like for jujitsu, the longest match I will ever be in is 5 minutes long. But for most jujitsu athletes, most at my stage of the game, where you're using less skill and more physicality, for lack of a better word, we go anaerobic almost instantly, which means that, for those out there who don't understand, it means lactic acid is building up in my system faster than my body can clear it. Right? That's known as anaerobic, and so I need to train my anaerobic system as much as I train my aerobic. So for me, Tabata is like central theme of my training, where I'll go 5 minutes of rowing, 20 seconds on, 10 seconds off, 20 seconds on, 10 seconds off, because that does mimic in many ways what we do in the jiu-jitsu mat, where you try to do a move, you try to pass guard, you're trying to hold guard, you're trying to get into an arm bar, you're trying to get somebody into a choke, and you're going hard for 20 seconds, then maybe you stop, catch your breath for 10 seconds and go. So, do you know much about Tabata and its impact on anaerobic activity?
Yeah, I mean, I think it's been shown to be one of the best to kind of increase that and to kind of backpedal a little bit. I think, and it'd be interesting to hear your thoughts on this, is that you did do a lot of triathlon training, running, endurance training. And I do think a lot of that, and there's a guy named Paul Maffetone who kind of created the 140 minus your age to kind of like find your zone too easily. But all this high intensity work is predicated on the idea that you have a good foundation to begin with, right?
Right.
And so if someone was coming into this out of shape and this was their first kind of attempt at going after that, to expect them to only do Tabata to have this, fitness, I think you need to have the foundation first built to
Right.
kind of raise your ceiling with the Tabata.
Agreed.
And, perfect example, I'm on a triathlon team. We had a guy come in, a professional MMA fighter, and the sports evolved so much that these old school MMA guys would just fight, and their coach would tell them to just go run for fitness with no real direction. And he comes into an amateur triathlon world, and all of a sudden it's like, oh no, you have to run this distance at this heart rate, and we're gonna like periodize your training. And the top level guys are doing that now, but the game has changed. I mean, people are using a lot of this science and really getting efficient with their work so that they can kind of maximize their the growth.
Yeah. And, at my age, I'm 57. The advice I was given is that arguably the number one way to increase the longevity and quality of your life is muscle mass. You said it
Yeah.
earlier, right?
Yeah.
And so resistance training is the center of everything I do, is to put on muscle mass, or at least to maintain muscle mass. Because, and that's one of those things I tell people like my wife, I tell a lot of my friends, a lot of people listening right now are over the age of 40 or 45, and they don't do a lot of serious weight training. They do a lot of HIIT, they do a lot of running, they do a lot of biking. And I try to tell them, hey guys, it's okay to do a lot of biking, it's okay to do a lot of running. But in my opinion, and I'm just a lowly orthodontist, you need to do two things. You need to be doing some serious resistance training in your life, and you need to be taking in a lot of protein. Like
Yeah.
those are the two things that to me, anybody over the age of 40 or
Yeah.
45 needs. Would you disagree with that?
No, no, no. That's great advice, and I would even say, And we're talking a lot of sports specific stuff, you jujitsu, me with triathlon. So
Right.
our regimen is going to be very curated differently than the average
Yeah.
person trying to get fit. But yeah, I mean, and this is, we were probably going to get into this, but I have a lot of people. We kind of also need to know where we're starting.
Right.
So, we start if people want, we kind of recommend get a very thorough blood panel so we can get a baseline for where the blood work is. Then we'll do a DEXA, which most DEXAs will not only show their bone density, but we're looking at their lean body mass, body fat percentage, and their visceral adipose tissue.
And
Uh,
by the way, when he says
yeah,
DEXA, folks, he's talking about a DEXA scan.
yeah,
It's
full
it's
body
it,
X-ray.
it's
Yeah,
like a full body X-ray you lay on. You can get it in any city anywhere in the world right now. For here in Dallas, if you get it like twice a year, it'll be like
yeah.
$49
Yeah,
per
yeah,
scan.
easily. Yeah, and if we can get an idea for what that lean muscle mass, especially at 40, we just want to make sure that it doesn't decline at all. And if people have no idea what their baseline is, usually people that embark on a fitness journey wish they would have gotten one 10 years ago so that they could
Agreed.
watch their progression. But yeah, and if someone is just balancing their week out, yeah, you should have 3 days where you're doing some sort of cardiovascular workout. I think there should be a range. One day easy, one day hard, one day moderate. And the gym weight room should be the same. One day easy, one day hard, and then one day kind of moderate. And then you have a recovery day or a day that you kind of, maybe walk or do something kind of super easy.
Yeah, my Saturdays are my recovery day. And I again because just I just may be doing things wrong, but for me, 3 days a week I'll do Tabata. When I'm training, when I'm not dealing with an ACL, I'll do 3 days a week I'll do Tabata because that's what the studies were saying. And maybe the other 3 days, and I'm doing resistance training 6 days a week, but I'm working into it, 10 to 20 minutes of Tabata maximum. I mean, Tabata is not an hour long thing.
No,
You're
no.
doing 10, 15 minutes Tabata max. And some days I'll work in before I do my resistance training, I'll work in a long tempo ride for, when I say long, I'm talking 30, 40 minutes just to get my aerobic base there, just to make sure things are going good. And, I think, like you said, the key is people understanding their bodies, knowing what they're training for. But the other thing is like you hear people talking about GLP-1 agonists, right? Like
Sure.
Wegovy,
Yeah.
Manjaro,
Yeah.
semaglutides,
Tirzepatides.
tirzepatide.
Yeah.
And everybody's like, oh, it's cheating, it's cheating. It's helped me tremendously. And if you have blood sugar issues or pre-diabetic in your family, it's going to help you. It's also going to help with familial hypercholesteremia if you're dealing with blood sugar issues. But here's the thing, and you and I have talked about this, and it's never discussed, never outside of like offices like yours or in my conversations with friends. When you take a GLP-1 agonist, which has been proven to be effective, safe, they work, they're great adjuncts to a healthy lifestyle. But if you're not careful, they're going to eat fat and they're going to eat muscle. So how many people are not doing resistance? I guess what I'm going to say is if you're going to go on a GLP-1, get your resistance training in hard and get a lot of protein in, because the worst thing that can happen, and correct me if I'm wrong, is someone goes on a GLP-1, let's just say they've got a 35% body fat, they lose a ton of fat and they lose a ton of muscle.
Yeah.
Now they get off the GLP-1, they haven't done any weightlifting, they haven't done any resistance training. Now they start gaining back fat and only fat, and now their body fat percentage is actually higher than it
Yeah.
was before they went on the GLP-1.
Yeah, and we look at and we're seeing a lot of that, and this is why we're recommending DEXAs to start with, is that I'm less concerned with their weight, I'm more concerned with their lean body mass
Right.
loss. And yeah, it sounds negligible, but if you lost 10 pounds, if you were 20 pounds overweight and lost 10 pounds, 5 pounds of muscle, 5 pounds of fat, you know how hard it would be to build 5 pounds of muscle? It would take you or I 6 months to do that. And if you're a 50-year-old woman who isn't hitting the gym as hard or maybe not used to pushing themselves, that might never ever come back. And then that's a
Right.
slippery slope to kind of, muscle injuries. We're seeing kind of random shoulder tears. We see a lot of postmenopausal frozen shoulder. And so these things, I'm not saying that they're linked, but we're seeing a lot of similarities here.
Yeah. Yeah. And since we're talking about things, I mean, like everything you talk about, when you say something, Jeff, it harkens back to a conversation we've had about something else.
Sure.
And so I want to lead into statins
Yeah.
because again, I have a family with, familial hypercholesteremia, meaning that it just runs in my family. You could eat fish all day long. We're going to have high cholesterol and by the way, because Jeff and I have talked about, we're not going to get into this one, LDL, HDL, VLDL, if that's all you're looking at, you're missing the boat with cholesterol. Cholesterol is not that. But the point is, I had a doctor put me on a very low dose statin, and all of a sudden I started tearing muscles. And I went to my physical therapist before I knew you, and they said, "Are you on a statin?" I said, "Yeah, I should stop it immediately because the peripheral neuropathies, the muscle tears." And I didn't realize how toxic statins can be to muscles and what have you. Do you see a lot of, and
Yeah,
again,
and
there are alternatives to statins nowadays.
sure. Yeah, and I'm skewed because they're probably coming to me for a muscle injury,
Right.
right? And so we get to talking, short of a lot of the Levaquins or things like that with Achilles tendon rupture. Yeah, statins really cause, and I'm not saying tears, but lots of muscle cramping and aches. And people that are active are more likely to tear a muscle if that muscle cramps. And really, I've seen people change brands of the same statin and get better. So there's a lot of nuance to that. And then there's, like you said, there are all these, Repathas and these drugs that kind of work in different mechanisms. And these things I think are, from what patients tell me, much harder to get on. You have to have a cardiologist, diagnose you with familial hypercholesterolemia, and then go down that rabbit hole. But the ones that have gotten it have controlled their cholesterol without any of the muscle pain. So this is just part of, like, obviously we won't recommend that. That's not in our space, but we just kind of advise to say, hey, maybe we go kind of see a cardiologist and go, analyze this blood work, like you said, with a more thorough lipid panel so that they can really kind of dive into that themselves. And then, then I love that because that means the patient is taking a lot of their health into their own hands. They're throwing their blood panel into chat GPT. They're kind of analyzing each one. Hopefully they're looking at how they can kind of fix a lot of these numbers on their own through diet and exercise, and then obviously bring in a lot of the medicine when we need it.
Yeah, and there's a lot of supplements, right? So,
Oh yeah.
and like my physician is like, look, Glenn, your broader numbers don't look horrible. Some of the old school markers are a little high. He goes, but you've never had anybody in your family ever die of a heart attack. You have a zero calcium score. He's like, maybe you don't need a drug of some
Yeah.
sort. So it comes down to you having a physician who's willing to take the time and look at you as a whole with your blood panel, as opposed to just saying, oh, your cholesterol's a little high. Here's a statin. Oh, and by the way, you may have some issues. And by the way, Levaquin, we're not going to get into, right? Because there are antibiotics that actually say they increase, particularly a particular family of antibiotics, which we won't get into now, which you mentioned before about Achilles tear. But let's talk a little bit about repair and
Yeah.
peptides, because that's
Yeah.
something that while the FDA does not approve such things off
Yeah.
label, and while certain people on this call, not you, Jeff,
Yeah.
might have used them a great deal and not seen a huge difference,
Yeah.
there are people out there who claim that it is a godsend, that the cocktail of BPC 157 combined with TB 500. And I will tell you, for every one person I know who will tell me that using it has changed their life, there's another person who says didn't have any effect on me whatsoever. And I'm beginning to believe it's very, very biotype driven.
Sure. Yeah, I agree. I just like you had said, I see a lot of people that, in quotes, have the Wolverine protocol, and using a lot of these stacks. And for some people, whether it's placebo or whether it's really having a massive impact, it's been, life changing. And I've had other people who've gone down the rabbit hole. Maybe they've stopped it too early. Who's to say maybe their injury exceeded what the
Right.
medicine or the peptides could help with. But yeah, the space is interesting. I mean, I really hope it keeps evolving. I hope they kind of get into a lot more research with this. I think the more people that start to take it, the more, maybe bro science evidence we'll have down the road. But so far, they seem to be safe. I know they're banned for competition, so we don't have any kind of collegiate athletes or any professional
Right.
athletes taking this. But
Although the all
yeah,
drug Olympics,
yeah, the enhanced games.
I can't wait. I can't wait to see the enhanced. When are they happening, by the way?
They've already had some preliminaries, and I think the first swimming event,
That dude, that
the
swimmer.
guy, yeah, I think there was $1 million bonus. I think if you broke a record, I think he
Can you
broke it
can
in the
you
very
back up a
first
second and
race.
explain to everybody what the
Yeah,
enhanced are? Because if you haven't
yeah,
heard about this, people, there
yeah,
was an old sketch on Saturday Night Live. I showed it to you, Jeff, from like 35, 40 years ago, where they had something called the All Drug Olympics. And John Belushi was entering, and he was on NyQuil and Darvon and some sort of fish tranquilizer, and you were encouraged to take every drug you could.
yeah.
Well, this isn't that far from this.
No, no, and I think they actually. I think with blind surveys, they've they think that a lot of Olympic athletes are taking something and it's probably sketchy, back alley sort of stuff. And so I think it was Peter Thiel and a couple other kind of like billionaires decided, well, let's actually provide all of the things that these Olympic athletes might need to kind of do better. Not just drugs, but let's pay them a salary so they don't have to work at Starbucks. Let's make sure that they have nice housing, make sure that they can devote all their time to training, and let's get the top level physicians to give them the best drugs and monitor them for their safety. And then let's also have the best competitions in the best locations. So swimming in Sydney, track and field in San Diego, maybe boxing in Vegas. But it's interesting. Yeah, yeah, I'm tuning in for sure.
Yeah, and again, there's $1 million prize if you break an existing world record, right?
Yeah, yeah.
And like
And
already the swimmer in his prelims, who by the way did not look the way he looks
no,
today.
no.
This guy looks like a bodybuilder in a swimming pool.
Yeah, the before and after pictures are, they're hilarious. And I think, as I think one of the founding members had said, if Lance Armstrong got done with the Tour de France and basically told America his stack that these drugs would be like flying off the shelves. And the fact that, as we talked about, these GLP-1s are already probably the most valuable drug ever made. And most of them prescribed off-label, potentially for vanity reasons, that this definitely would
Yeah.
take the cake, especially if you had the athlete and their profile on the side of the screen, height, weight, and then all the stuff they were taking. I mean, that would be incredible.
Yeah, I mean, look, if I had, I'm an orthodontist. If I'm in the entrance to my office, you say Glenn Krieger,
Yeah.
DDS, MS, FAGD, he's taking this and this and this and this, which
Yeah.
is kind of funny because, people who know me knew that I've always been, athletic. But a few years ago, I'm not private about it. I decided to really make a difference in my life and lost a considerable amount of fat, gained a lot of muscle. And I feel much better and I'm performing much better and I'm just better around in thinking and what have you. And there's not a day that goes by that a 40-plus-year-old man or woman doesn't say to me, hey, what did you do? And I'm
Yeah.
fully transparent. And I think the only way we get better is by sharing this stuff with each other because I'm not
Yeah.
doing anything illegal. Well, I mean, let's not. I've heard people take
Yeah.
BPC
Yeah.
157. I don't know who they are. It has nothing to do
Yeah.
with me. But
Yeah.
another thing that's worth talking about, right, for an injury, again, off-label use. Nobody's recommending you do this. Speak to a physician. But growth hormone. I'm not talking about growth hormone for long-term, because it has side effects long-term with diabetes and a whole series of things that can happen. But there's many, many people who recommend growth hormone to get started before you go through a surgical, an orthopedic surgical procedure where you might see atrophy of muscle or what have you. Have you seen a lot of people
Yeah.
doing that?
Yeah, I see growth hormone being used for, rehydrating tendons and adding muscle growth, decreasing atrophy. I believe it was what Andy Pettit kind of like said in his grand jury testimony in the Roger Clemens trial that, majority of these professional athletes to return to play faster are on somewhat of a protocol like that. And, these are professional athletes. They have a little bit more, rules that they need to follow. But yeah, I think that your doctor has to kind of weigh the risks of some of that. I think short-term use of it, for athletic return to play sort of stuff would be interesting to kind of, track a bunch of athletes and see how much it benefited them. And, I guess the issue is the dose is the poison, right? Making sure that we have the right amount that's helping and
Right.
not too much that's going to exacerbate anything else.
Yeah, I mean, look, if you're an athlete and I said to you, let's take someone like me, not a professional athlete by any stretch of the imagination, but is competitive and likes competing, and I like jujitsu. And you said, hey, Glenn, you tore your ACL, you're going to get it fixed, you'll be back on the mat in 9 months, maybe competing in a year, but nobody knows for sure. And you said, but you can take a little bit of growth hormone, little bit. I'm not talking about massive doses to where the point is, I'm putting on 30 pounds of muscle, but we know that a little bit can help you with your tendon, everything you said.
Yeah.
And you'll be back on the mat in 3 months instead of 9, and you could be competing again in 7, 8 months instead of a year. Would you like to
Mhm.
get that extra 4 or 5 months sooner with no other side effects? Who in their right mind would say no?
Yeah.
Right? Like,
Yeah, and I think you've maybe tried this with some success or not, but the Simorlins and the Ipamorlins, the
yeah.
the peptides, which and you had
You
said
scared
so,
me out of the CJC 1295 epimorelin.
yeah,
If it wasn't you, then it was Huberman. But I think of all the clinical trials that were done, the
Yeah.
only one where someone actually died was the CJC 1295 ipamorelin study. One person in the study died. They don't know why. They couldn't classify why. And for me,
Yeah.
that was
That
good
was,
enough.
I'm out. I'm out.
Yeah, I mean, they didn't classify it as cardiac arrest. They just said one person died during the course of the trial, and they couldn't rule out the 1295 as playing a role, though they didn't think it did. I'm like, I'm good. Plus, what I've been told is that that's a secretagogue. It's not the actual HGH. So, in order for the growth hormone to be affected, I've been told that CJC 1295, if you want to take that peptide, which is readily available online at any number of places, it takes 6 months before it really starts to show a growth hormone increase. And so you have to be in there for the long haul.
Sure. Yeah. Yeah. I've heard that. So if you're going for surgery in a week, that might not be the right, the right one to take.
But you could go, through your doctor, potentially get growth hormone, but it is very expensive. It's not cheap. It's not $165. If you're going to go growth hormone, it's going to be in the thousands of dollars for a short period of time. So just be aware. The other couple of quick things I want to talk about real fast: blood flow restriction, right? BFR. I got a pair of BFR cuffs. I'll let you explain to people how BFR works and when we use it.
Yeah, I mean, I think really, I think bodybuilders invented this without the technology that they had, and so as is a lot of this stuff that we're doing for recovery, it was built out of the bro science world. But yeah, they've gotten really good at, I think, figuring out that the point of working out is to reach exhaustion, right, or failure. And then that creates a cascade of muscle growth, natural growth hormone release, testosterone production. And that is the goal when we go to the gym, is to get close to that without injury. And I think if you could do that with less weights and less reps based on modulating the blood flow to the muscle, then you kind of like make sure you hit your goal. And some people use this at the end of a big workout anyways, just to make sure that they burn out these muscles. I actually really think that their space is better served in rehab, because if you're doing your ACL repair and you can't lift barely any weight at all, but you still want to reach exhaustion without fatiguing or hurting that region, they have these digital kind of blood pressure cuffs that can go around the leg. I think they restrict, probably 70% of the blood flow. 30% blood goes in, making that muscle kind of scream and starve for blood. And then you get the benefit of taking it off at the end, and it, rushes the blood back to that region, and starts that repair process.
Yeah, and just to add to that, if you don't mind, I just want to throw a little bit more. For those out there who don't know what BFR cuffs are, it's blood flow restriction, and I do use it during my rehab at my physical therapist's office. They are the ones who use it with me, and that's where it started. And the theory is this, as I understand it, because the human body is glorious in its design, and the blood flow going to a muscle is deeper than the blood flow leaving a muscle, right? Because
Yes.
the blood flow to the brain is much more important than the blood flow leaving the brain, let's just say.
Hmm.
So the veins are surface, the arteries are deep. So when you put a cuff around somebody's leg and you go to 70%, what ends up happening is the veins get constricted, constricted a bit, and the arteries are generally relatively unaffected. So as you're working out at lower weights and you're fatiguing the muscle at 25, 30 reps, the lactic acid builds up, but because the veins are kind of constricted, it can't really leave. And then at the end, when you take off the blood flow cuff, uh, it's not on for more than 20 or 30 minutes at max. When you take it off, all of these metabolic products immediately dump into the body. So you've basically fooled your body into believing you had a harder workout than you might have really had. But the repair process treated as if you had a crazy monster workout. So growth and regeneration happen at a much faster rate. Did I say
Yeah.
that properly?
Yeah, yeah, that's right. And you see a lot of top athletes. I know Roger Federer was using it a lot for his knee rehabilitation, Djokovic. You see LeBron James on the sidelines trying to
Yeah.
accelerate a warm up for a game. And so I think, short of any sort of nerve compression issues, which some doctors kind of wary from because nerves don't like compression, yeah, they've been super safe and super effective. I think,
Yeah.
and I think as we all these things that we're talking about, it's what can keep you in the game the most, and help you recover so that you can bounce back the next day and go, just as hard, if not harder.
Yeah, and again, I'll just throw this out there because it was told to me by my physical therapist. He had said to me two things. He said, never longer than 30 minutes with a blood BFR on you, and never 2 days in a row. He said you increase the risk of clotting if you go longer than 30 minutes or go 2 days in a row. So I'm just throwing that out there, what I was told by my physical therapist.
Yeah.
Last two things I want to talk about, well, actually three, but we can go through them pretty quickly. Saunas. I have a
Yeah.
sauna. I love my
Yeah.
sauna, but I go really hot because you were the one who told me you got to go hot if you're going to do a sauna.
Yeah, I mean, I think most of the Nordic studies show that 3 days a week, 20-minute plus at I think 180 to 220
180.
was the sweet spot.
Yeah.
And I do think this is another proxy for exercise. I think getting in there, you're basically sweating, your body's kind of getting up, probably not to 220, but you're releasing these heat shock proteins, which can help repair. I think there's a little bit of discomfort that gives you that reward process because you have to kind of tough it out.
Yes,
And
you
if
do.
anybody,
Yes, you do.
if nobody's done over 180 into the 220 mark, you're counting the seconds after about 8 minutes.
Yes. I've gone as high as 205.
Yeah.
I did 11 minutes at 205, which people out there are like, you're freaking bananas. But there's a level of scientific fitness that you run in, that I run in, that a lot of people run in. The Brian Johnson. Did you see Brian Johnson,
Yeah.
by the way, what he was doing
Yeah.
the last 24 hours?
Oh, with the mushrooms?
How did that turn out? At the time of this recording, you'll know when it
Yeah.
is. Brian Johnson, we're not going to get into,
Yeah.
but he's the guy who's trying to be 18, but he's older,
Yeah.
and he's a billionaire, and he's just using every. So he decided yesterday he was going to take 5 grams of psilocybin and draw 29 vials of blood and do like an electroencephalogram and do like every scientific study there is to do while he is on a hero journey
Mushroom journey.
of psilocybin, and he was going
Yeah.
to do it live stream. Did you watch it at all?
I didn't. I was kind of tracking along on his like X feed, but yeah, I got lost. It was too much.
It was just too much. But
Yeah.
kudos for him for trying to push the envelope and see,
Yeah.
you
No,
know,
he's entertaining. I mean, and he's come up with a lot of, just good topics of conversation. And
yeah,
one of the things I think he caught onto, which is I was going to draw back to the sauna, is, I really feel like sauna's communal. I think a lot of people get a benefit from doing it with other people.
yeah,
And likewise, we'll probably get into cold plunges as the counter to sauna, is that cold plunging is way more fun when other people do it because you're experiencing that discomfort with other people.
agreed.
Now, I think the science is pretty clear cut on the cold plunges that doing it post workout is not great. It does not help the
Right.
recovery process.
Because it actually inhibits muscle
That's
growth
right.
and what have you.
But done 7 hours post might create a better sleep, right? And we know sleep is kind of king for recovery. And also, it's been shown to really be good with people with anxiety, mental health, because the first thing that you do in a cold plunge is have to control your breath and
Right.
really can only think about one thing. So there are other elements other than just musculoskeletal recovery for that.
And what I've seen is that the science on sauna seems pretty unequivocal. It seems pretty, this is what it does. Here's where heat shock proteins are released. Here's what it does with cardiovascular. The studies on cold seem to go up and down. Like I think they say, look, if it makes you get peace of mind, if you feel better because of it, if you sleep better or anything like that, then do it. But we can't tell you that there are studies that say it's so much better for you, correct?
Yeah, and in terms of performance, heat training and doing sauna or immersion post exercise is supposed to have an exponential benefit on blood plasma volumes, which increased blood plasma volumes help you compete at hot temperatures better
Right,
versus altitude, where altitude might increase, the size of your red blood cell, but not necessarily the plasma.
got it.
So, they're two different kind of training tactics, but we call heat the poor man's altitude, right? So if you could do a 10-minute hot tub after one of your jitsu matches, well, hopefully we'll get some muscle rehab recovery out of that too. But you'd slightly start to increase your blood plasma volume, which may make you tolerate higher lactate levels down the road.
Oh, interesting. I didn't know that.
Yeah,
Yeah, and my partner Doug Shaw, he loves doing cold therapy every single day, cold plunge. And his response to me was a fair one. He goes, I don't care about the science. He goes, when I get in 37 or 39-degree water for whatever amount of time he's in there for 5 minutes, he says, if I start my day with that, then I know there's nothing that can hit me during the day that's going to be stronger or harder than that. So
sure.
it,
Yeah,
it creates a mental well-being for him, which,
yeah,
if
yeah.
I can do
Can't
this,
argue.
then
Yeah,
I can do anything else. Because
that's
I got to
right.
tell you, folks, I used to do cold plunge and I've done 39 degrees for 5 minutes. And I can safely say, without any shadow of a doubt, I've never been more miserable in my life.
Yeah, it's terrible.
It was the worst.
Yeah,
That was literally the worst 5 minutes of. I
yeah,
would sooner go back and take a dental board exam with live patients, and
yeah,
while fighting somebody in jujitsu in a lion cage, then go back and do that again because it was so miserable. And I have Raynaud's syndrome, so I didn't even know I had Raynaud's until I did it, and my hands and feet look like cadavers. So I'm done with cold plunge the rest of my life. Um, and the last question I had for you, because I know we could do this for days, but we're coming up on an hour, and I want to be mindful of your time. Exosomes. Exosomes are things that we see nowadays in the med spa industry. For I put exosomes on my face every night before I go to bed, um, as part of my skincare routine. But we can use exosomes in many ways. Do you want to explain?
yeah.
Can you explain what an exosome is?
Yeah, I mean, I
And
think again, this is not 100% my space, but exosomes are like cell signalers. So the example I use, you roll your ankle. Like, why does it swell? Well, you have these exosomes that are signaling your body for that inflammatory response to trigger like the healing mechanism. And so they've been able to kind of isolate these exosomes out and then re-inject them back into a region in hopes to let it heal. And much like the PRP idea is that we're just going to bathe this area in a whole bunch of good stuff and see what happens. And yeah, I mean, similarly, I think that space is, I had a Navy SEAL who had bad tennis elbow from shooting, and he was offered a free trial to get these at no cost. And so I think they gave him, you know, the standard doses, like zero impact whatsoever. But I've had other people kind of use them in the spine to kind of trigger like a healing response. Um, and whether it's placebo or not, most of the spinal injections force rest, so people have to take a break. So that might have got them. And I just recently kind of read, and I think these studies were kind of pushed out in 2021, but they're starting to nebulize them for people with fibromyalgia, and they're way less expensive. So if exosome therapy was $4 or $5,000, these would be like maybe $600. And there's, a condition called CRP or fibromyalgia. These are conditions where, I mean, some people are doing like ketamine resets for these. Um, and so this would be low hanging fruit in terms of an experiment with, like low downside. So haven't had anybody do them actually, but I've kind of been reading about that.
it's funny the side effects of the things we do, like the unintended. Like for instance, when I do compression boots, I
Yeah.
fall asleep,
Yeah.
right? And wow, well, your legs are above your heart, so you're blah, blah. No, it's because I'm forced
Yeah.
to sit and do nothing for 30 minutes.
That's
And
right.
like the first 6 to 10 minutes, nothing happens. I'm sitting there, I'm working on my computer, I'm doing, because I can just sit there. And then all of a sudden, like if I go for 30 minutes in compression boots, when it hits, the last thing I typically remember is around 16 minutes.
Yeah.
And then all of a sudden I wake up from the beep of the
Yeah.
machine because the 30 minutes is up because
Yeah.
you're forced to do nothing.
Yeah.
And
And
so
sometimes for, high achievers like you or myself who just can't sit still, forced rest might be the best thing that we could do is just take a break for the day.
no, it's beautiful. I love it.
Yeah.
I packed them with me on vacation because
Yeah.
after my knee surgery, I wanted them. And I'm telling you, every day I came at home from doing our trip, whatever we were doing, I'd sit down, I'd do it. And it would be like a forced nap before I went, because I do an hour. I forced nap before I went out to dinner. It was wonderful. And the very, very last thing I want to ask, because you reminded me of it, because it blows my mind, is the new concept of recovery with ice versus heat. That's something that you and I have spoken about that I think for a lot of people out there, it's going to be very hard for them to wrap their heads around this one. But you want to talk a little bit, because you explained to me about pitchers in baseball and sort of the scaffolding related to ice. Do you mind touching on that for just a minute or two?
Yeah, I mean, I think the orthopedic doctor who coined the term RICE, like rest, ice, compress, elevate, uh, when presented with the new information, had kind of recanted on his original statement, thinking ice should be used. And the way I look at it is ice topically is reducing blood flow to and from the area, which is really not helping with what we want to achieve for recovery. We want blood to come there. We obviously want to manage too much swelling. Can be done with compression, can be done with movement if the area isn't injured too much, which is where maybe muscle stim or sort of the electrical therapy might help. But yeah, they used to ice mandatory pitchers post games, right? These guys would, regardless if they had a shoulder injury, just ice it, and they weren't seeing pitchers shoulder injuries go down. And then I forget who broke the mold, but they started to just at home games where they had more time, they put these guys on the Airdyne bike where they're moving their arms a ton to kind of pump the blood out. And on away games, because of time constraints, they'd put the mobile muscle stim units on there. And lo and behold, the next, the more guys that started doing that, shoulder injuries started to plummet, pitch counts went up. I think elbow injuries increased because they were pitching more. But so yeah, so I tell people that ice, Advil, things like that, like sleep is king, as we said before. So if you can't sleep because of pain, let's start with the easy stuff. Let's try to numb it with some ice. If you need to take some Advil to kind of knock down a little bit of the discomfort, go ahead. But if you can manage it, then let's not do that. Let's try to do the manual stuff and kind of use the thing that we know is going to not derail your kind of healing. Because I don't think it delays it a ton. It just doesn't create that scaffolding that we want right off the bat when an injury takes place.
Does that apply to joints, muscle? Is there a
Yeah, I mean, I
difference?
think if you're an 80-year-old and you're just getting up in the morning and your knees are achy, we could kind of heat those a little bit with a heating pack.
Yeah.
But for the most part, both of them are pretty vanilla. I mean, they're topical heat on the skin. They're not penetrating a ton deep into that joint. Whereas movement is heating that joint and that muscle from within, right? Out. So we're always going to err on moving the muscle, moving the joint whenever we can. If you can't due to injury, then I or someone will try to move it manually for you. And if we can't do it that, we might use these other modalities like the shockwave or the muscle stim or things like that to kind of promote that healing.
Right on.
Yeah,
Jeff, I could do this for days.
I
You
know this
know,
is fun.
the amount of stuff you've taught me about recovery. And again, I've chosen a sport that most late 50-year-old people don't want to do, or they do it and they just don't compete because it's pretty brutal. Jiu-jitsu is pretty unforgiving. But, knowing that I've got someone like you in my pocket, so to speak, where I can come in and, I'm going to feel way better when we're done and I'm going to get some great information about how to deal with it. If someone is not in Dallas, right? If they're in Dallas, how do they get a hold of you? What's the best way to reach out to you if they're anywhere near Dallas?
Yeah, I'm in a facility. It's the Banner House at T-Bar M. It's a racket club, so we're in a sports facility, so we see a lot of that. But you could kind of look that up online. But yeah, I mean, most of the time I'm a sports chiropractor. Kind of that's my training. Not everybody's the same, but if I was looking for someone, I would kind of go down that rabbit hole, just searching that out, and then unfortunately, like everybody, it might be a little trial and error finding someone that wants to be on your team and wants to be part of the kind of journey. Like I love listening to all your competition stories and not necessarily the injuries, but like that if I can keep you in the game, I mean, I kind of love that stuff. So, that's what I look for.
Is there an organization or a society that you belong to that if someone were to look to say, oh, I'm a member of this, then, oh, they probably are practicing similarly, or does no such thing exist?
Yeah, so active release technique is kind of a foundation for a lot of the manual therapy, and they do have a certification technique and a website you can go to and do a provider finder. They kind of have such steep yearly rates that most people do all the certification for the learning and then don't re-up their website advertisement on them. So, like I wouldn't be listed on their site. And so I technically, don't advertise that we do that sort of branded sort of therapy. But that's kind of how I kind of recommend people go to maybe one of those sites or chiropractors use a CCSP, kind of like an abbreviation afterwards, a certified chiropractic sports practitioner, a whole series of courses that kind of make sure someone knows what they're dealing with athletes. So both of those have practitioner finders on their sites.
Fair enough. Hey, thank
Yeah.
you for all you do for me. I hope
Yeah.
people got a lot out of this.
Yeah.
Hopefully, this helps somebody or helps someone's child. And we didn't get into so many more things. So, if people really find this interesting and want to learn more, we can always jump back in and get into things
Yeah.
like muscle stim or needling or all the other fun stuff we didn't even talk about. So,
Yeah.
Jeff, thank you for all the good work you're doing. As soon as I'm done with my rehab,
Yeah.
I'm back on the mat, which means I'm going to
Yeah.
be living at your place and just really appreciate you more than you can imagine.
Yeah. Yeah. Anytime. Thanks, Glenn. It was a blast.